Today we will discuss about the orbit. We have removed the skull cap, and this is the right side of orbit, and this is the left side of the orbit. This is the orbital plate. We have not cut on the left side, but we have cut on the right side. This is a crista galli, and this is a cribriform plate. We have removed already the orbital fascia. After removal of the orbital fascia, you can see the first nerve, which is the branch of the ophthalmic division. It is the frontal nerve, and this frontal nerve which divide into the two branches. Medial one is the supratrochlear and the lateral one is the supraorbital branches. This supratrochlear and supraorbitals, both of which is supplies to the upper eyelid as well as it from the supratrochlear notch, it comes outside and it is supplies to the skin of the forehead. After this, we have see the muscles. It is the first muscle. It is the levator palpebral superioris. This is the levator palpebral superioris. We have cut these muscles, and after that, you can see there is a muscles. It is called the superior rectus. So, levator palpebral superioris and superior rectus both of are supplied by this third nerve. This third nerve, which is goes inside. Here you can see it is goes inside, and it gives the upper division, and this upper division which gives the two branches, which is supplies to the levator palpebral superioris and superior rectus. Both are supplied by the upper division of oculomotor nerve. Other, here you can see this is the trigeminal ganglion. We have dissected the trigeminal ganglion. You can see this is the ophthalmic division, this is the maxillary division, and this is the mandibular division. Amongst the ophthalmic division and maxillary divisions, which is come inside the cavernous sinus, these are the structure which is within the cavernous sinus. So here you can see this is the structure within the cavernous sinus are the third nerve. After that, you can see inside there is a just below to it. Here you can see this is a superior oblique muscles. This one is the superior oblique muscles, and this superior oblique muscles, which is the supplied by the fourth nerve, it is a trochlear nerve. So the fourth nerve, which is crosses from lateral to medial sides, and it supplies directly to the superior oblique muscles. And this superior oblique muscles anteriorly, which makes the pulley and round over the medial to lateral side, and it is inserted on the sclera, and contraction of these muscles, it lead to there is a intorsions of the eyeball. So the eyeball which is rotated on the clockwise, so it lead to there is a intorsions of the by the superior oblique, and it is supplied by the fourth cranial nerve. It is the smallest nerve, cranial nerve. On the lateral aspect, you can see there is a lateral rectus. Other branches of the ophthalmic division, here you can see this is the ophthalmic divisions. First, we already discussed the frontal nerve, and after the frontal nerve, we will see inside there is other nerves, which is the crosses from lateral to medial side, and this nerve, it is a nasociliary nerve. So this is a nerve which is the nasociliary nerve, and this nasociliary nerve always which is lies between the characteristic of the nasolacrimal nerve, it is the passing from lateral to medial. It is a branch of ophthalmic division, and it gives so many branches. It gives the anti-ethmoidal, posterior ethmoidal, as well as it gives the intratrochlear branches. The posterior ethmoidal, which supplies to the ethmoidal and sphenoidal air sinus. Anti-ethmoidal, which is supplies to the it goes inside the pierce to the anti-ethmoidal foramen, and it supplies to the nasal cavity, and it gives the external nasal branch as well as it gives the internal nasal branch. The infratrochlear branch, which supplies to the conjunctiva, it is the supplies the conjunctiva, lacrimal sac, and caruncle, and medial end of the eyelids, and upper half of the external nose, which is supplied by the infra trochlear nerves. So these are the three branches of the nasociliary nerve, And nasociliary nerve, it is a branch of the ophthalmic divisions of the trigeminal nerve. So this is the second nerve. The characteristic of nasociliary nerve is that it passes between the superior rectus, and below it there is a optic nerve. So this is the optic nerve. So it crosses from lateral to medial sides, and it passes between the superior rectus, and it passes between the optic nerve. Third nerve, branches of the ophthalmic division, it is the third nerve, it is the lacrimal nerve. This is a lacrimal nerve. This white color is the nerve, and this pink color, it is the lacrimal artery. Always you have to remember the lacrimal nerve and vessels which is passes above to the lateral rectus. So superior border of the lateral rectus, there is a lacrimal nerve and vessels which is passes, and this lacrimal nerve which supplies to the lateral part of the eyelids and lacrimal glands. It is also carries the secretomotor fiber from the postganglionic fiber from the ciliary ganglion. Always you have to remember there is a ciliary ganglion which is lies between the lateral rectus and optic nerve. This is the optic nerve, and in between at the apex, this level there is a situation of the ciliary ganglion. So these are the three branches of the oculomotor nerve. It is the branch of trigeminal. Oculomotor, it gives the lacrimal nerve, it gives the frontal nerve, and it gives the nasociliary nerve. Now we will discuss the other structure of the eyeballs. Here you can see this is the third nerve. This third nerve, which is it divide into the two branches. Upper division, this is the upper division we already discussed. It supplies to the levator palpebral superioris and superior rectus. And here you can see this lower division which goes downside, and this lower division which is it divide, and it is the longest branch of the lower division of oculomotor nerve. It supplies to the inferior oblique. Here you can see this is the lateral rectus, and just below to here this is a nerve to the inferior oblique, as well as this is the inferior oblique muscles of the orbit ocular muscles. This is the inferior oblique, and this is the nerve to inferior oblique along with its. And so the inferior division of the oculomotor which supplies to the inferior rectus, inferior oblique, and also it supplies to the, and it gives the branches to the medial rectus muscles. Here you can see this is the optic nerve. We have just got the sheath of the optic nerve, and inside you can see there is optic nerve. Along with it there is a, you can see this is the central artery of retina. This is the central artery of retina. It is a branch of ophthalmic artery. The ophthalmic artery, basically it gives the three main branches. Central artery of retina, this is the lacrimal artery. The lacrimal artery, again it gives many branches, recurrent meningeal branches. It gives the posterior ciliary branches. It gives the supraorbital and supratrochlear branches, and posterior ethmoidal artery, anti-ethmoidal artery. All these are the branches of the ophthalmic artery. Lacrimal artery, mainly it gives the branches to the glandular branches, to palpebral branches, to zygomatic branches, recurrent meningeal branches. So ophthalmic artery, basically it gives the branches to the central artery of retina. It gives the lacrimal artery. It gives the nasociliary artery. Nasociliary, gives the anti-ethmoidal and posterior ethmoidals and supraorbital branches of the ophthalmic artery. On the medial aspect, here you can see this is the medial, this is the superior oblique, and just below to it, on the medial aspect, this is the medial rectus muscle, and this medial rectus which is supplied by the inferior division of oculomotor nerve. And this is the superior oblique which is already we discussed, it is supplied by the trochlear nerve. This is the optic nerve. Here you can see this is the third nerve, and this is the six nerves, lateral rectus. Here you can see this is the lateral rectus, and this lateral rectus which is supplied by the 6 nerve. This one is the 6 nerve, and just below to it, here you can see this is the inferior division of the oculomotor nerve. This is the inferior division of oculomotor nerve, and this is the oculomotor nerve. Here you can see this is the oculomotor nerve. So this is the abducent nerve which supplies to the lateral rectus. So this is about to the orbit, and the other structure you can see under this trigeminal ganglion. You can see this is the 6th nerve. It is the abducent nerve which is passes front side and it enter into the orbit. This is the internal carotid artery which makes the siphon, and this is a cut end of the internal carotid artery which makes the circle of Willis. This is the optic nerve. This is the hypophyseal fossa, and this is the infundibular stalk of the pituitary gland. And here we have already dissected the ear, but we will not discuss right now. Thank you very much. Hope you enjoy the lecture of the orbit.